Welcome to Clinical Conversations. On today's Smart Chiropractor Show, we are going to revisit a talk from Axis 2021. That's Smart Chiropractor online clinical conference. Stay tuned for details for Axis 2022 coming soon. One of the highlights of last year was Dr. John Rosa. He is an expert on the opioid crisis and epidemic. He has worked at the highest levels of government, and he is one of those guys that knows more about this topic than just about anybody that I have ever met. And we were fortunate to have him contribute a really, really great presentation to Axis 2021. We're going to revisit some highlight clips from that presentation right now on today's Smart Chiropractor Show and Clinical Conversations.
Which makes an overdose the leading cause of death for Americans under 50. Now, even during COVID, I mean, obviously COVID, we know most of the deaths due to COVID were elderly and those comorbidities, and the elderly meaning over 50, but the needle did not move. The number one cause of death in the United States of America for people that are under 50 years old is an opioid overdose. Let that sink in. So the CDC study, this actually comes up in some of the meetings that, because of the surrogate team that I'm involved with the White House, I do sit on calls that are pertaining to usage and mental health and stats and up and down. And some of the things were brought up about the prescriptions going from 30 pills in a bottle to only 8 days. That's how we're going to fix this. But if you look at these things, if you look at the study that was done, even somebody given it 1 day in a hospital setting ended up refilling prescriptions. There was a 6% chance just having that one pill that you followed up later to a year later to be continued using it. And a 2.9% risk that 3 years later from that one pill, you still were taking the prescription. So 8 days, that jumps to 13.5, 30 days to 30%. So back in the day, if anybody remembers, yourself or your family members or parents or older, the population, that the doctor was God, what they said had to be done, and every medication that was given to them was treated like an antibiotic. You had to finish it. If you took a 30-day, I got my wisdom teeth were removed. I had a 30-day prescription for Percocet. I said I didn't need it, and I was told, you never know. You don't know if you're going to get a dry socket or a problem later. Take the prescription in case. That's how the market gets flooded. You twist your ankle, go to the ER, it's not broken, it's swollen, and it hurts to put pressure on it, and you walk out with 30 OxyContin. This was happening hundreds of thousands of times a day, and literally. Now, if you took it and you just figured I'll just take the 30 pills because it does hurt, you have a 30% chance that a year later, you're still taking those prescription medications. These people did not start out wanting to look and feel and be who they are. This is some work that I had done in a county sheriff's office, and I did a lecture, and they supplied some pictures of the first arrest to the last arrest before they overdosed and passed. But this is a 7-year turn of a person who, if you think that person on the right of the screen wanted to be that person compared to the one on the left, you're mistaken. A lot of times we look at these people and say, you walk by the street and you can see somebody lying there, you know that there's an issue, and you're like, look what you're doing to yourself. We really should be saying, look what we did to you. Like, society has not been grasping this well enough. There are some people that just have mental health overlay that is so strong that it's a difficult task to separate. But for the most part, most of the mental health overlay is just people using, not for pain purposes, but to numb their existence. This is a 7-year period, same person. You can tell the guy on the left did not want to become the guy on the right. And here's a 4-year period and a 1-year period and only a few months, what happens with usage. Secondary personal effects. Now, this is not just, of course, we're looking at the fact that people become dependent and addicted, and it has an effect on the individual who can obviously pass from an overdose. But the secondary effects, the ripple effects that occur as a societal change, those families are completely disrupted. Relationships dissolve, friendships disappear, theft is involved because they have to keep up a habit, incarceration issues, rape because there's people that are putting themselves in those positions in order to obtain money for drugs, depression, suicide, and sex trafficking. Sex trafficking is a big deal that we don't realize actually intertwines. I'm actually co-producing a documentary that should be out at the end of this year. It's all revolving around sex trafficking, but my influence was on how people, these young people being brought in and trafficked are actually being put on opioids or heroin so that they can be controlled, because they'll make them dependent and then they'll stay in that trafficking system just so that they can obtain the drugs. So there's other things going on besides a bad prescription. And secondary economic effects, this is interesting because we're looking at $608 billion a year influence. These are the actuaries and accountants and futurists that look at what the true cost is, and not just the cost of the death or the cost of the medicine, but the decrease in workforce, the dependency, the cost of police and coroners, EMS and the healthcare system. All that stuff adds up when you're talking about a crisis. $608 billion a year is kind of fascinating. And if you guys, I know if you're on this and you're looking for information, tidbits, research, you're part of this organization, stats are important to you and information is as well. That 608 billion is actually reflected very similarly in our low back pain issue and its economic effects. So from an overdose or drug use perspective, to be 608 billion, and so is low back pain on itself, and we know what we can do for both, you're looking at a 1.2, $1.3 trillion issue that we can have a massive impact on. If that doesn't get the attention of your local community and political circles, as it does as in the higher ups, because believe me, when I'm in these meetings and I'm at the level of the White House, I'm shaking that cage for all of us and I'm throwing numbers around that mean something so that you can get the attention of people. But I need everybody who's listening to understand, you want to get into these circles, you got to learn just the basics. So some of this stuff is just, it's overpowering, it's upsetting, but it's knowledge and that you can keep in your brain, in your hands to have these conversations. So contributing factors, we're going to look at what else happens, right? So there's a breakdown of reality. Over 50% of addicted have associated mental health issues. That number is actually much smaller. I'm looking at saying it's 100% because there are people with mental health issues that are susceptible more for dependency and addiction. But once anybody gets into the dependency state, the mental health overlay is insanity because they don't want to be doing what they're doing. Their brain is telling them they need it. They know it's detrimental to themselves, but they still, that's literally the definition of addiction, that they continue to do something they know is harmful, but they do it anyway. And that mental health overlay, whether it's the start of the problem, during the problem, or the end of the problem, it's always there. And if you look at the charting over the last 20 years of anxiety, depression diagnosis and addiction diagnosis, they slide together. They're one and the same. And if we have the 24-hour news cycles, the social media, competitive success, like people are living in the basement of their parents' house in their 30s, and they're watching all their high school friends post as they're in Tahiti on vacation. It's debilitating to some people. Cyberbullying is an issue. False sense of community. You could have 1,000 friends on Facebook. None of them are showing up for coffee, right? And so you really don't have, it's isolation in and of itself. And that isolation only grows during a time when we're being told that we can't see people, talk to people, look at people, gather with people, have fun with people. That isolation exclamation point is massive during COVID, and the effects of it post-COVID are going to be shattering. Here comes coronavirus, right? And coronavirus is pounding on the three heads of the beast, that you cut one head off, it grows back. You cut all three, it grows back. And especially when that tail in the background is dictating, you literally got to cut all four of them off at the same time to make it go away. But substance abuse is massively up, which obviously revolves around the mental health issues that go along with it, with stress, anxiety, depression, sleeplessness, domestic violence, and suicide are through the roof. So we're actually seeing the timing is right to have these discussions in a medical circle, because everybody's going to be looking for these alternatives outside of of medication as we find out and look under the hood on how they're actually making things worse instead of better. So, you're living on pins and needles for obvious reasons, and the stress hormone levels are going to be produced and supersede what our normal good chemistry can produce. This is where the susceptibility for addiction, dependency on a foreign substance comes, because we're not producing the happy, feel-good chemicals that we should be. And the flight, fright, freeze responses are on high alert. Obviously, fear of we have the virus, and fear of financial issues and a job, whether you're going to have one, or is there going to be a check coming in at the end of the month. Fear of child development and students. There's poor people who have children and they had to take care of themselves, and then their depression levels are visible. Anger over injustice, racial divide, political election series. What we went through was an incredible divisiveness, and anger over loss for obvious reasons. That kind of constant bombardment of fear and anger only stimulates the sympathetic nervous system and not the para, which actually puts us in a normal state of homeostasis.
That was Dr. John Rosa at Access 2021, and we're looking forward to Access 2022. Jason, that was one of the most powerful presentations. We just looked at a small section in the middle, and any doc watching this, listening, if you had you need an extra kick in the butt to get out there, to be present in your community, to build relationships with other healthcare providers, to let people know who you are and what you're about. I can't think of anything more powerful than that talk to showcase just the depths of really what's going on out there. And I know many of us at times, whether we run a pain center, a performance center, a wellness-based practice, you start to see things day in and day out, and maybe some of us become sensitized over time. And this is a stark reminder of what's really going on, to the tune of hundreds of thousands, millions, tens of millions of people, when you look at the impact that these medications have made over the last 20 years, that most of it starts with chronic pain, that 30 to 50% of individuals in the United States, adults, report having chronic pain. And when we have the answer, yes, can chiropractic do so much beyond that? Absolutely. But man, we have a lot of work to do to help people really get their lives in order with a natural healthcare solution. Jason?
Jeff, that really is it. And I just sort of pause with a sense of, you just almost can't believe that, this is real. And you touched on it. Yeah, there's plenty of things for us amongst chiropractors to sort of debate about. Is it for pain only? Is it for other things? We can debate all we want to about that, but you can't deny the fact that we are effective in helping people feel better with most of their musculoskeletal issues most of the time. That's just what the data says and what your clinical experience shows. And yet here we are with pretty much, the number one cause of death is people becoming drug addicts because they don't know where else to turn for their musculoskeletal problems. That says exactly what you said, Jeff. I'll just simply reiterate, we've got a lot of work to do, and there's plenty of opportunity. There is no shortage of people out there who need your services. So it's always one of those sort of WTF moments when, we talk to chiropractors, we see collectively chiropractors present from stage to an audience hungry to learn how to get more new patients, as if there's a lack of them, as if there's some secret. And the reality is, we're saying it over and over again, it's almost too obvious that if you'll teach and invite consistently, if you will share with people what they don't know about their ability to self-heal, if you'll invite them to take a next step, which is likely to work with you and find out if they've got some sort of issue or problem, a subluxation or some other issue or concern you can help them with, if you'll teach and invite them, and the key word is consistently, you should never have a problem attracting people who need and want your services. But if you just see yourself as a technician waiting for people to magically somehow understand that you've got magic hands to help them without putting out some sort of message to go, hi, I'm here, you're going to miss the major opportunity. Even McDonald's and Coca-Cola, and there's no lack of pharmaceutical advertisements over and over and over and over, spending millions, in some cases billions of dollars reinforcing their message in your community's mind. The reason is because that repetition works. If you're looking to figure out how to finally crack the code on making sure people understand what you do in your community, then understanding what Dr. Rosa talked about, really feeling that in your heart, not just your own need of your stress, of your financial needs, but you really understand that with your hands, with your heart, and with your mind and mouth, you can communicate with people how you can be helping them in a very natural and effective way. You will never need a new patient again. That's really what this is all about. Stay tuned for Jeff and I's new book coming out called The Payday Practice. We're going to keep repeating it. It's coming out soon. And the reason we're going to keep repeating it is because it is the way, once and for all, to finally eliminate your monthly financial stress so that you can afford to tell people the truth about what you do, the truth about how you can help them, the truth about what long-term care might do for their benefit, for those that choose it. Not because you're forcing them, not because you're convincing them, not because it's the only option, but because you have articulated it in a way that most people go, nobody's ever explained it to me that way before. That makes a ton of sense. Let's do what you're talking about. That's what it's all about. Thanks for bringing this one back out. I don't know any greater opportunity, and it just stares our profession in the face of how we could let this epidemic, continue on without really rising and shining, at least locally in your community. Collectively, who knows, if thousands of chiropractors start going, I can help you, I can help you, I can help you, we might see that collective shift take place. And I sure hope that we do.
Hey, if you like that video, be sure to subscribe to The Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.